Has that come up okay for everyone? Yeah, brilliant.
That's good.
Okay, so thanks for introductions. I suppose just a bit more about me in terms of who I am. So please, as much as it's really nice when people introduce me as Dr. Natalie Brown, please call me Nat. That's definitely preferred way of yeah, my name. And then in terms of who I am and what I do, so I'm a research associate based at Swansea Uni, and I work with Sport Wales. Um, and a big part of the work I do is around female health. That does vary in terms of like the menstrual cycle, breast health, pelvic floor health, but I suppose my expertise really lies within the menstrual cycle and how that affects both athletes that are kind of more at the elite end, all the way down to participation. So I do a lot of work within schools as well in terms of supporting girls to be physically active. And a big part of that is anything that surrounds that kind of athletes, people participating in terms of their coaches and their support team. So my background is actually in physiology. So I worked within kind of elite sport as a physiologist. Across the years, I have worked with Welsh cycling quite a bit in and out. So I leave and then reappear. So it's really nice to be here talking tonight. So just to get started, I suppose a few key things when Fiona asked me to join tonight, I thought I'd kind of focus on would be really think about how we can help females to feel confident and comfortable talking about their menstrual cycle if they need to. Supporting female participants, so as cyclists, to take part and perform on any day of their menstrual cycle, and some of the considerations for training performance. And I suppose number two is a key one for me. There's lots in the media in terms of how do we maybe train at specific phases across the menstrual cycle, whereas I quite like to shift that and really look at how do we support females to be able to perform at any stage of their menstrual cycle. So in terms of some factors specific to female participation, tonight obviously we're talking about the menstrual cycle, but just I suppose to raise that awareness, other things to consider are like breast health, hormonal contraceptive use, pelvic floor health, differences in like psychology, anatomy, and biomechanics. There are quite a lot of factors that are female specific, and I suppose just to have that awareness. So in terms of the menstrual cycle, I always start off by saying females are quite fortunate having the menstrual cycle, even though the perceptions sometimes are complete opposite to that, because it's almost like you've got this extra vital sign. So we talk about within sport, heart rates, so many different markers physiologically, and sometimes we don't consider the menstrual cycle. Yet that provides an extra sign in terms of giving individuals an indicator if actually something isn't quite right, maybe if they're not fueling correctly, if there's any sort of underlying medical condition that might need treatment. It really does give this extra kind of sign. If symptoms all of a sudden become more severe, again, that might indicate the effects of stress, and it really is a holistic approach. So a quick, very brief menstrual cycle 101. When I talk about the menstrual cycle, I'm not just talking about the time of having a period, I'm talking about the whole cycle. So that is a repeating pattern in which hormones fluctuate in hopefully a very set pattern. Some of those things I've talked about in terms of influence in the menstrual cycle, they can cause that pattern to change, to shift, and to then that relates to different symptoms that might affect training and performance. So a typical cycle is 21 to 35 days, with day one being the first day of a bleed. And then periods typically would be about 3 to 7 days. And really to highlight that actually it's irregular, it's not normal to miss a period. So in terms of what does that look like? So I've just talked around these fluctuating hormones. So hopefully this just brings it to life a bit more. So day one, as I said, would be day one of a period. And then this would be anything from 21 to 35 days. I really like to highlight that because I think quite frequently we kind of focus on it being this average 28 days, but different individuals will be slightly shorter or slightly longer, and that is completely normal. And we can split the menstrual cycle up into different phases. And the reason I talk about phases is it can really help to understand when different symptoms might be experienced. So if I talk about, I'll just break these down in terms of the titles I've got across the bottom of the graph there. So early follicular phase, that's the time of having a period. And that is usually when there's low estrogen and low progesterone. When we move into the late follicular phase, you have this spike in estrogen, but progesterone still stays low. And that's some of the reasons why there's been some conversations in terms of this is the phase that you train really hard because you've got more energy, you've got more confidence, you might be more motivated. And also estrogen as a hormone is what we describe as anabolic. That means it helps to build, that helps to support muscle growth, muscle development. Whereas when we look at the mid-luteal phase where you've got high progesterone, there's actually this increase in progesterone, which is catabolic. So that is the opposite effect. So it means it can break kind of muscle down or affect adaptation. So that's the premise in which that kind of changes in training have been based upon. However, there are different strategies that we can put in place that allow training to still be maximized, still be optimal, still gain the benefits during this kind of mid-luteal phase. And then in the absence of pregnancy, you have this really rapid decline in both estrogen and progesterone in the late luteal phase. And it's the rapid decline in those hormones that can cause a lot of symptoms we associate as PMS, so premenstrual symptoms. One thing I will flag is what I've just described. If I go back one, that is what a normal menstrual cycle, so a natural menstrual cycle would look like. If we consider hormonal contraceptive use, and I'm only going to touch on this briefly tonight because I think we could have a whole nother conversation in terms of hormonal contraceptives. But you can see actually the pattern of any individuals using hormonal contraceptives is quite different. So the purple line, that is someone on a combined pill. They take a pill daily. There's an increase in those plasma concentrations of hormones up until that declines throughout the day, up until the time they take the pill the next day, and you get another spike. So each day you get these spikes. Those levels, however, of hormones are below your kind of lowest level in a natural cycle. And the differences as well in terms of different types of hormonal contraceptives. So this would be a progestin only or like the mini pill. So again, you can see in just a pill, you get these spikes, but they're again much lower levels of hormones. And in like an implant or an IUD, so that's the blue and the red line, they're very consistent and very flat. So you don't get these peaks and troughs. It can be very consistent and very flat. So just for me to kind of highlight, I suppose, what I'm going to talk about for the rest of the session is focused on a natural cycle, but just to be aware that obviously there's completely different profiles when we're thinking about hormonal contraceptives. There are different reasons that you might use hormonal contraception. One thing alongside the changes in that kind of graph that I highlight is also the fact that if there is a bleed, so if someone experiences a bleed when they're using hormonal contraceptives, that is not the same as a period. So the reason I highlight this is at the start, I've obviously said having a menstrual cycle, having a period is a really good extra vital sign. However, if someone is using hormonal contraception, that bleed is not the same. That bleed occurs because of the withdrawal from synthetic hormones, and it's not the same as having a natural period. So therefore, we can't use that as an indication of having a normal, regular menstrual cycle. So just something to flag in terms of if we are thinking about The menstrual cycle has been that extra sign, that indicator, especially around energy balance. Actually, someone using hormonal contraceptives, we can't use that bleed as the same kind of indicator. And then the second thing with hormonal contraceptives is if anyone is experiencing symptoms and struggling with symptoms, there's usually a better option. So it might still mean they can still use hormonal contraception, but go and find out a different, try a different form. That might be the same, like, so again, keeping it to the same, like mini pill, for example, but just a different brand. Or it might be swapping completely from using a pill to maybe an implant or an IUD. Everyone interacts with the synthetic hormones differently. But it's important to know when struggling with symptoms associated with that, because there will be an alternative and a better solution. So in terms of, I suppose, the reason we're talking about this, within an athletic population, we know that up to 93% of athletes actually report performance detriments associated with the menstrual cycle. The reason for those kind of performance detriments linked to some of these symptoms. I have just taken and put on this screen the most common symptoms. I think there's like meant to be over 100 different symptoms that people might experience related to the menstrual cycle. But these are just some of the really key common ones that I've pulled out. So abdominal pain is one of the most common, I think, that is reported. But also within athletes, I tend to find fatigue and tiredness, reduced motivation, and changes in energy level also being like really commonly reported, and more so in athletes than what I find in more of a general population. But equally, all of these symptoms have been reported by female athletes that I've worked with. Some athletes might have one or two of these. Others I've worked with, and they're like, I pretty much tick every single one of those symptoms. So again, it's around having that conversation to try and understand what symptoms they are experiencing, and therefore maybe what kind of could be done to reduce that. So what I'm going to do now is kind of start mapping where some of those symptoms might be most commonly experienced in relation to the different phases I mentioned. So for example, in the early follicular phase, most common symptom is bleeding. And I know that sounds really obvious, but sometimes we don't see bleeding as a symptom. And the reason I put that is because some people might have really heavy bleeding. It can also, from a sport perspective, cause a lot of anxiety in terms of leaking, being able to manage that whilst they're competing, being somewhere new or even training, what facilities are there in order to be able to manage bleeding, being able to change menstrual products. Stomach cramps frequently cause missed or adjusted training. Other things in the early follicular phase from the list of symptoms are back pain and sleep disturbance. Quite a lot of the time I find sleep disturbance is associated with the bleeding or the stomach cramps that is kind of disrupting that during this phase. Late follicular phase, things like improved recovery, confidence, feeling energetic, feeling strong, feeling focused, ready to maybe try a new skill, have a challenging conversation. So this is where naturally a lot of athletes will say to me, actually, I don't experience any symptoms, whereas sometimes I try and pull out some of these positive ones, because this is almost the phase that we're trying to help an athlete achieve and feel this way across their whole menstrual cycle. The mid-luteal phase, so this kind of mid-luteal to late luteal, as I said, this is where a lot of the more negative symptoms tend to be reported. So things like bloating, gastrointestinal disturbance. So some athletes struggle with constipation, some struggle with diarrhea, and that even might shift across the different timings of those phases. Temperature increases that can make training and competition feel harder. that perception of effort can be higher. They might also start experiencing weight changes here, food cravings, reduced coordination, so things like struggling with spatial awareness. But equally for some people, they feel kind of quite calm during this phase. So really find like planning, being organized, key in this time. So again, if you're looking at a new training plan, training program, actually for some, this is a really good time to have that conversation. And then finally, the late luteal phase. So this is all of the above that I've just mentioned in terms of the mid luteal phase, but with the addition of things like headaches, decreased energy levels, decreased motivation. Potentially getting ill or cold symptoms can be quite common in this phase. As you can see, there are low mood swings, irritability, breast pain and swelling is also quite common within the late luteal phase. One thing I will say is, although these symptoms are all super common, they should not be debilitating or stopping anyone completing daily activities. So if they do, that's when I say to seek medical advice. So to give an example, if someone's got severe stomach cramps that aren't eased by pain relief such as paracetamol, ibuprofen, or if like heavy bleeding is needing to change period products every hour or always needing 2 products, those sorts of symptoms are not normal. And again, that's when seeking some advice from your GP is really key, because actually there are things that can be done when those kind of symptoms are that severe. So I'm just going to pass over to you for a minute to have a little think about. I've just taken an example of fatigue and decreased motivation, because that's quite a common symptom in athletes. And how might that affect training? And I just want to kind of like open it up, share, everyone can share some thoughts on that. And then I will provide some thoughts around management strategies to wrap up. So over to everyone. What are your thoughts on how fatigue and decreased motivation might affect training?
I think I normally tend to struggle with getting out. So I might not struggle. I mean, I find the training harder, but I feel like the difficulty comes from me not wanting to do it. And most of the time, once I'm out and I do it, I kind of enjoy it. I never come back disappointed from the training, but it's the willingness to go out that I really struggle with during that phase.
I think that is really common. Quite a lot of people like once I get going, I'm like I can get there and like I can get into it and actually my energy levels improve or my motivation improves. But sometimes it's like the getting started or the getting to training or initiating, going out and doing that training that you've kind of got planned can be really difficult. Anybody else? I was just looking in the chat as well to make sure if anyone's commented on anything. So you might skip a session or choose an easier option. It's been mentioned. No get up and go, so easier to sit on the sofa after a long day of work. So that sounds quite similar in terms of that getting started. Any other thoughts in terms of how fatigue or decreased motivation might affect training?
I guess I was just going to, oh God, I don't know if someone else wants to speak then or if it's an echo on my microphone, but I was just going to say that I guess sessions themselves probably feel a bit harder. So like planning like a really difficult training session in that phase is probably going to have a bit of an impact in terms of what you can get out of it and how mentally you feel trying to approach something like that as well.
And I think that's it sometimes, isn't it? Like, especially like if we also consider, because obviously this is quite, I've purposely put this on here because you've got an element of a physical symptom of fatigue and a psychological symptom of decreased motivation. And actually how those two link together might also affect like whether you feel like you're not going to have a successful session. Like if you're feeling low, like feeling fatigued, you're like, oh, actually, what's the point? am I going to be able to achieve that session today? Should I just not bother? Because then actually sometimes that's easier than getting started or trying to overcome that.
I was just going to say that for me, this goes hand in hand with what you're saying about sort of it's to do with food. And like at this point, I can never, there's always maybe something I'm looking for and I can never quite find it. So for like sort of maybe a week, my energy levels are so low and I'm feeling tired and lacking motivation. And no matter what I eat, I'm sort of always hungry and I feel like there's just something I'm missing that I maybe should be eating. That I can't find. So I relate this to that as well.
No, and I think that's a really good point. And actually, one thing to pick up on with that is actually around that fatigue and those lower energy levels. We naturally have a shift across a menstrual cycle from within that follicular phase to using glycogen as our fuel source. Glycogen is quick releasing, so that gives you immediate energy. So if you're doing those higher intensity sessions, or like strength training or HIIT or anything kind of like higher explosive stuff, that energy is quickly available. Whereas in the luteal phase, we actually move to a predominance of fat as your fuel. And fat is great for really slow, low intensity stuff, but it's slow to start releasing. So especially when you start exercising, you feel like it's really hard work, you've got no energy. And also it's really slow in terms of providing that energy. So doing anything that's higher intensity will also feel much harder. So I talk quite a lot in terms of nutrition around that kind of fatigue. I'll put up on my screen some ideas. And one is actually to think about fueling. So actually, what is the timing of our fueling and what we're eating? So I always say like try and have food every like 3 to 4 hours with both carbohydrate intake, but especially in the luteal phase, if you've got someone who's like fatigued or low energy, to have an additional snack to fuel like immediately before training. And that can be kind of quite high energy food. So that might be a banana. For me, Haribo is like the key for me in this phase. Like it just gives me that burst of energy that I feel like I'm able to start a session. But also, I have to make sure I've kind of had a regular intake of carbohydrates through the day so that I've kind of got that energy source available. And that's the same kind of a process I'd use a lot with athletes. So I look at timings of food. So like every 3 to 4 hours, having a meal or a snack that is carbohydrate containing. And that can be really helpful in the luteal phase. Other things I've put up on there is, as we've already said, usually once you get started in training, those symptoms can reduce. So thinking about how can you support yourself, or if you're coaching, how can you support others to motivate them to get them started? And that might be just looking at the shift in your goal or what you're aiming to achieve, or even what the warm-up's like, to kind of feel that you might have to just change the warm-up to kind of start the session, engage them. Might need to be a bit more chilled, and then once you've kind of got that session started, again that can then help to really continue after that. Creating a support network, so again that might be agreeing to go out with someone, train with someone else, or again like organize that if you're coaching anyone, because sometimes if you say to someone, right, I'm going training, you've made yourself accountable that you're going to do that. And if you're lower motivation around this time, like having that planned or having that person you can say, I'm going to go and train in the morning, train in the evening, whatever time that is, it can really just help you go, okay, I've said that out loud and I've kind of committed to it. So that can also help you to get started. But also then monitor each month to see if any factors cause these symptoms of fatigue and motivation to be worse. So is that insufficient fuel and food? But also is that other strategies like stress, Or have you had poor sleep? Have you had a lot of travel, which is going to have a knock-on effect with your fatigue levels? So alongside that, I suppose what I've just put up there, and this might be a place that we can talk around and have more kind of questions and answers in relation to, is there are different management strategies to use. The first one is self-awareness and monitoring. So I always kind of recommend, if anyone doesn't already, to track their menstrual cycle and symptoms for 3 cycles. Once you've done it for 3 cycles, you'll be able to start seeing patterns emerge in terms of what symptoms you experience related to your menstrual cycle. And then from that, you can then start looking at, okay, what do I do about that? What different strategies can I put in place? That might be menstrual products, so the actual management of the bleed. That might be anti-inflammatory medication for any sort of stomach cramps. And with that one, as long as there's no underlying medical condition to take ibuprofen, I always recommend taking it the day before you're going to start your period, because the cramps are caused by inflammation in the body. So what we're trying to do is reduce that buildup of inflammation in the first place, so it doesn't cause severe cramps. So even if you can't do that every single cycle, that's when I always definitely recommend around competition time, because then you're not risking competing with stomach cramps. Hot water bottle and heat patches, those two are quite reactive in terms of if you've already got those symptoms. But what I like to try and do is, as I've said, is really think about the ones below to be proactive to try and prevent these symptoms occurring in the first place. So that's thinking about lifestyle, reducing stress, considering your rest and recovery, and actively planning that recovery in. So it's not just a day you're not training, but actually planning in what recovery strategies are. Thinking about sleep hygiene, so your quality and quantity of sleep. Nutrition and food, so really thinking about not just the timings and fueling, but also things like anti-inflammatory foods. So fruit and vegetables can really help reduce symptoms. Whereas pro-inflammatory foods, so things like cake, crisps, ready meals, all those sorts of things that are processed foods, they can actually increase inflammation in the body that can make symptoms more severe in relation to the menstrual cycle. And then finally, doing some light exercise. So even if you feel that like training, or you've got someone that's really struggling to train because of symptoms, things like light exercise, yoga, stretch and mobility, they can actually really improve symptoms as well. So it might be a case of starting off the session with some mobility work, and then, seeing if that eases the symptoms, helps improve motivation, whatever that might be, to then kind of move on to the next session. So that's a whistle-stop tour in terms of menstrual cycle symptoms and potential thoughts around some management strategies, but happy to kind of stop sharing and open that up to have like some conversation relating to this, and if you've got any questions.
Yeah, that sounds great, Natalie. I was going to say, yeah, if you want to stop sharing.
Let me stop sharing.
I think I can do it for you.
There we go. Sorry about that. So if I stunned everyone into silence, or has anyone got any questions?
I just want to firstly say how I feel like I've read into that stuff so many times now, but it's still feel like I learn something every time, and that was really, really good and really interesting. So thank you, Natalie.
So what tips have you got if we are approaching the luteal phase and we know that we're going to be low in energy, motivation, but we have a big ride or big event or a big week coming up? How do we manage that? The fact that we still have to perform, but obviously we have to balance the side effects as well.
Yeah, that is a great question. So we're starting to especially if you track, you'll start potentially identifying the factors that are maybe triggers for symptoms for you. So if I give myself as an example, when I'm more stressed, those symptoms will be much worse. So I really kind of start looking at to try and work out what kind of more lifestyle based or holistic symptoms potentially cause your symptoms to be more severe or actually improve them. So in the lead up in the luteal phase, things I always focus on is making sure you've got good nutrition. And that's related to the timing of your carbohydrate intake, your anti-inflammatory foods, and also your protein intake. Protein doubles up with recovery. So in terms of after you've done training, making sure you've got a really good high quality protein intake, so that prevents that kind of muscle damage or like breakdown that I described at the start. And again, that can support kind of how you're feeling physiologically, ready to compete and train. And then again, the other factor is looking at reducing your stress and managing your sleep. If you're away competing, thinking about sleep strategies, so that might be taking earplugs with you so that you've definitely got like a quiet environment to sleep in. Might be something as simple as taking your own pillow so that you've kind of got that comfort and you know you're more likely to have a good night's sleep. Because if you potentially feel more prone to feeling fatigued or low in energy, actually having good nutrition and good sleep are going to really help reduce the severity of that. So it's kind of looking at those the factors that influence you the most, and then kind of making sure you're proactive in terms of planning that in.
Perfect, thank you.
And actually, I've got some slides I could share in terms of fueling, timings, examples of carbohydrate and protein snacks as well that I'd be happy to share that might be useful. Just things like I remember when I was kind of training quite a while ago now, but someone said to me like, oh, you need like 10 grams of protein, and I was like, great, what on earth does that mean? I was like, that's brilliant. I have no, so sometimes just like some ideas or like ways to mix up that kind of protein intake. So yeah, I can share some of those examples that might help in terms
I'll
like
any tips.
yeah, no problem at all. So yeah, I've got like a little table of like 10 grams and 20-gram protein ideas, and then a bit of a diagram in terms of timings of carbohydrates, and again, what you might eat is those kind of snacks or main meals of carbohydrate intake.
Amazing, thank you.
No worries.
I have a question, Natalie. I know you've talked a lot about like trying to maintain like exercise and training through the cycle by managing symptoms and stuff. But do you recommend that people, if you're really focused on your training, actually try and plan your training around the cycle a bit more, so you're almost like ease off the training when you know you're going to be less motivated and fatigued and more at risk of maybe getting ill or like burning out, and then plan the harder training when you know you've got the motivation? Or is that a bad habit to get into?
So I sometimes say that might be helpful whilst you're kind of navigating your symptoms and working out what's going on, what affects you, so that you can still kind of make the most out of training. The one thing I say is the flip side to this is, and it doesn't affect everyone, but I've definitely had some athletes that this does affect. If you get used to not training hard at a certain phase of your menstrual cycle, and then you have to compete in that phase, psychologically, you're like, I'm not used to trying hard in this phase, and now I've got to race. And I know it can obviously be different in terms of like your adrenaline, your motivation on race day can be different to day-to-day training. But if you're not used to trying hard in that phase, it can really almost put you in a kind of on the back foot, I suppose, of going into race. Whereas actually, if you've taken the approach of I'm managing my symptoms, I've been proactive, I know I can train, I know I can perform at any phase of my menstrual cycle. That ultimately is confidence in itself to be able to go and compete and be able to perform at your best. Because sometimes, you know, from a research perspective, it's really mixed. But physiologically, there isn't any proof that that changes across in terms of performance across the menstrual cycle. What does change is the perception of how we feel. So actually, if we can really tap into ourselves in terms of how we're feeling, acknowledge that and think, you know, trial different ways which actually overcome that, actually that can be really helpful in making sure we can compete consistently. But as I said, it might take a bit of like trial and error, and during that time, potentially, you know, training harder when you do feel great and easing off when you don't can be helpful just whilst you're kind of navigating that.
Okay, thank you.
Can I ask a question?
Yeah.
Oh, so are you saying with the research you've done that people's performance, I mean, I'm just talking PBs here, there's not a sort of physiology time in the cycle, which is where they're sort of getting those PBs more? Is it, I mean, has the research been done on that?
There is limited research, but what has been done, it doesn't really show much difference. The caveat I will say within that is normally it's like grouped. So everyone's grouped and an average is taken. So the only thing that hasn't been explored yet is actually looking at the individual person and individually if there are differences across a menstrual cycle. So that's when I always say, like, everyone's unique and their experience of their menstrual cycle will be completely different. So that kind of almost one of the key things is having a conversation, understanding the symptoms, and if it is affecting performance. But as I said, from a research perspective, on average, there are no kind of performance changes.
Thank you.
I've got a question. I was just wondering, like, when it comes to slightly older people and we're starting like with perimenopause and menopause, how do we know, like, you know, symptoms that are our typical menstrual, or are they perimenopause symptoms? You know, it's such a minefield to know what's going on, that how does it all affect us, because obviously menopause affects us differently alongside the natural menstrual system anyway. It's
Definitely the transition from menstrual cycle to perimenopause, I think, could be, like, honestly a really difficult time to navigate, because you start thinking, is that symptom related to my hormones? Is that just like I call them life symptoms? So that's kind of when I really encourage just trying to track and being able to track your symptoms to see if there are any kind of patterns in that. If you notice anything's related to your cycle or if it's becoming irregular. So an indicator of if you're kind of going into perimenopause is also you might have changes in your period in terms of like regularity or heaviness or lightness of bleeding as well. So sometimes that physical symptom can help identify if some of those other symptoms related to hormonal changes are linked to going into perimenopause or not.
okay. Thank you.
Natalie, I was going to say, if no one else has any more questions on that, whether you would mind doing like a couple of minutes on like red S, because I feel like it's just something I come across quite often and that people have no idea what it is, and even just like a couple of minute overview.
Yeah, that's absolutely fine. And that links, I suppose, with at the start talking about having a menstrual cycle as being a vital sign and the importance of having a regular period. So when you said REDS, that is relative energy deficiency in sport. So some people might have heard of the female athlete triad. That's previously what it was called in terms of female athletes lost a period. It was because of the amount of energy expenditure. That's now been retermed relative energy deficiency in sport, because it's much broader than just your period stopping. But that is one sign. So essentially, if your energy intake isn't in balance, so think about scales. If your energy intake isn't balanced with your energy expenditure, or your, what energy you're using for exercise, but also just your daily bodily functions, if that's tipped out of balance, one of the signs related to that is a period becomes irregular or it stops completely. In no situation is it beneficial for a period to stop, okay, because there are so many health implications related to that. So bone health is compromised if you've got no periods or irregular periods, but also things like your cardiovascular health, your ability to make decisions. There are a whole host of different symptoms around the body that are influenced by low energy. Females are really fortunate that actually their menstrual cycle and period stopping is an indicator that maybe you've not quite got your energy balance, your energy intake quite right, which males don't have that. And again, it is something that can affect males equally to females. So female athletes, you're fortunate in some ways that you've got this extra check-in. If your periods start becoming irregular or stop completely, and you've maybe had an increase in training load, or you've changed your diet, again, that can be an indicator that that balance isn't quite right.
Great, thank you.
That's okay. And just one thing I will say is, if you do go to your GP for support or advice in terms of period stopping, please don't let them tell you that having no period is normal because you do a lot of exercise, because that is not the case. It should not be affecting you having a regular period.
And I can vouch that GPs do say that as well.
Yes, that's kind of, hopefully we are on work in progress to try and change that. But I do work with especially a lot of younger athletes that are told that that's absolutely fine because you do a lot of exercise, whereas that is definitely not the case. Having a regular period is so important, not just for health, but for performance. Like, ultimately, if you've not got enough energy for your period to be regular, you've definitely not got enough energy to be able to perform at your best.
Great, thank you.
Nat, one more question for you, if that's okay.
Yeah, of course.
First up, same as Fionn, like I know we've worked together quite a bit over the years, but I do feel like every single time I do learn something new, so that's really, really helpful. And it's always really good to have a good refresh on everything as well. I know there's a few other coaches on the call as well, or people that work with potentially like young athletes and stuff, and you spoke at the very beginning about creating that environment or having like open conversations, and I just wondered if you had any tips around like how we can do that more. Like, I like to think that like I try and be approachable, and maybe because I feel comfortable about talking about it, it's easy to assume that others would. So like in terms of working with young female athletes, any tips on how we can really encourage it to be that open conversation around the menstrual cycle?
Yeah, I think one key thing is that I always like to share is everyone's concerned that someone else will feel uncomfortable or awkward. If you, as a coach, can open up that conversation, that really helps create an environment where your younger female athletes will also feel comfortable talking about it, because they've maybe, for example, in school, those conversations still aren't normal. So for you to kind of set that openness, create that environment is really key. And that can be as simple as saying, just like to a group of athletes that you've got, just you're aware actually the menstrual cycle can affect everyone differently. If anyone is struggling, please let me know. We can have a chat in terms of how we can support you in training, or kind of give some ideas in terms of how we might manage that. And even just almost initiating that and open that, you might get no one come to you initially, but you've kind of set that openness that is something that's okay to talk about. And the other thing is, I always do it as well, especially to start off with, in terms of like linking it to training performance. So saying, I'm aware that actually the menstrual cycle might affect you in terms of how you feel training or how you might manage competition. That's something we can discuss. So that's kind of one way that I do that. The other thing I've done in different sports is we've done like a bit of an education session, depending on the age, potentially would do that with athletes and parents. So again, it really provides that kind of openness that this is an important topic and actually this is why we're talking about it. Just to kind of, again, create that openness, but provide the rationale as such in terms of why we're doing that.
Well, thanks, Nat.
No worries.
Awesome. And you've got like a website and like resources and stuff that I can direct people to as well, right?
So I've got my website, Optimal Period, which there's loads of stuff there in terms of the menstrual cycle. And at the moment, I'm also adding more information around training performance. So things like recovery, nutrition, injury, all those sorts of things are currently being added. So you'll kind of see more being added to that at the moment. And eventually, when I say eventually, hopefully in the next couple of months, there'll also be a bit of a section in terms of perimenopause and menopause symptoms on there. So yeah, that's not there yet, but it is, that one's in planning.
Can I have another question, Natalie? Sorry.
Yeah, no worries.
Talking about, you talked about muscle growth at one phase of the cycle.
Yeah.
Is there a particular phase of the cycle where you're slightly increased prone to muscle injury? I think I heard something about the footballers and research about ACL injuries happening at a certain time in the cycle. Is that something that there's research or information about?
Yeah, so there's some research in terms of ACL injuries. And there's kind of two stages where there might be an increased risk, and there's different reasons for that. So just before ovulation, so in that late follicular phase, when you have an increase in estrogen, there are estrogen receptors in connective tissue, so like in ligaments. So when estrogen binds to the estrogen receptors, it can make them more lax, which can mean there's more joint movement, more risk of kind of susceptibility to injury. And then the other phase is that pre-period phase. There can also be a risk of injury, and that relates more to fatigue, reduced coordination, and kind of lower concentration levels. That actually, it's almost like that clumsiness, you make mistakes, you're not concentrating as much, which increases the risk. With both of them, but especially the follicular phase one with estrogen, there's ways to mitigate that in terms of the warm-up that you do and looking at making sure that we're loading tissue that decreases that laxity, so it makes the joints more stable. That's just like one small component though of why there might be a risk of injury in females. So for example, things like the Q angle, so that's like the hip angle, and then how the knees track, that causes a lot of injury as well. And also just the level of training. So especially in football, we've seen that female football players haven't had much training history, and then all of a sudden that's massively spiked, and they're doing high training loads, high competition schedules, and there's just that underlying fatigue that they're maybe not used to. So although there is some hormonal links, it also is kind of more broadly, I don't want to just pull it down to that.
Thank you. That's really interesting.
Okay, great. Anything else? Or hopefully we can let you go, Natalie. So
Yeah, no worries at all.
yeah.
I'm always happy if anyone's got any questions, just pass on my email in